Measles outbreak across the U.S., including here in Florida, doesn't seem to be slowing down. Measles was considered eradicated in the country 25 years ago, but so far this year, confirmed infections are in the hundreds. News for Jax reporter Eric Avignon explains how researchers at the Jacksonville Center for Clinical Research, they're speaking out, Eric, about how the measles got here, why it continues to spread.
Well, Joy, local researchers say that the measles is like that one weird and unwelcome relative you thought you got rid of or tried to avoid, but for some reason keeps coming back. This is what the measles virus looks like under a microscope. And this is what a person infected with measles looks like as the virus causes unsightly skin rashes. According to the latest CDC measles outbreak map, the virus has spread across the country. So far this year, there have been 800 confirmed cases. 11% of those cases were so bad that they required hospitalization. Here at the Jacksonville Center for Clinical Research, Dr. Michael Corin oversees human clinical trials of new medications and vaccines. We sat down to talk about the resurgence of a virus that was once eradicated in the U.S. What has caused this resurgence?
Well, there's a number of factors, of course, but the biggest factor is that we got a little lax in terms of our vaccine prevention strategies. So although we had a period of time where there were no measles cases in the United States, of course, people are coming in from overseas. And when they come in from overseas, they're exposing people. And people who are not protected based on having been vaccinated will be the nidus for developing the spread of the disease.
So far this year, the U.S. measles outbreak has killed 3 children who were not vaccinated. This CDC map illustrates child vaccination rates by state. For example, it shows that between the 2023 and 2024 school year, only 88% of children in Florida were vaccinated. Dr. Corin says many parents have chosen not to get their child vaccinated because of information that suggested that the vaccine was linked to autism.
That link has been thoroughly discredited. There's no link between the measles vaccine and autism. It's just not true. There was a report years ago by somebody that mentioned it that has been completely discredited. In fact, the person that made that statement was a physician who's lost his license.
A measles infection primarily spreads the same way as the flu or the common cold. Once the virus is in the system of an unvaccinated person, it attacks the respiratory system and then spreads throughout the body. Small children and adults with weak immune systems tend to suffer the most from the infection. And in some cases, they don't survive. And so far this year, all the measles cases reported here in the Sunshine State have been reported down in South Florida. And in all of those cases, children were the infected. Reporting live, Eric Avignon, Channel 4, the local station.
Thank you, Eric.